2-year-old Stephen Coffey has had a liver transplant, and his father says he deserves a chance at life like everyone else. But the country's measles outbreak has presented complications. Stephen can't be vaccinated for medical reasons, like many other children out there.
So it's frustrating for me as a parent. It makes me angry when I start to think that you say, well, my child's life is more important than the masses.
Virginia resident Stephen Coffey Sr. says his son relies on the immunization of other children to be safe. But that's at odds with the so-called anti-vaccination movement, grown out of fear for potential side effects of vaccines.
If there's a no exceptions, one size fits all.
Barbara Lowe Fisher, president of the National Vaccine Information Center, which wants informed consent for parents over vaccinations, says the debate is about civil liberties.
Are we going to be in a position in the United States where government can license vaccines that the companies produce, the government recommends them, but the people don't have any ability to make any choice? In fact, if you try to make a choice, you're punished for making that choice.
But Dr. Susan Wollersheim says choosing not to vaccinate puts young babies and pregnant women at risk, not to mention people who are immunosuppressed.
Measles for an immunocompromised patient is a very serious condition. It can be life-threatening, and it can cause very severe pneumonias, very bad encephalitis, and even death in these patients.
Her message is this: the MMR vaccine for measles is safe, and children that are healthy enough to receive it should. Not just for their own well-being, but for the well-being of others.
Gave him a gift. I'm like, oh my God.